We've come together today in recognition of World Hearing Day. World Hearing Day was actually yesterday, but we're celebrating here today. Before I begin, I'd like to acknowledge the traditional owners of the land on which we're presenting from, the Wallumattagal clan of the Darug Nation. We acknowledge the traditional custodians also of the various lands from which you are joining us today, and the Aboriginal and Torres Strait Islander people participating in the webinar. We pay our respects to elders past, present, and emerging. For those of you who don't know me, Carolyn Mee, I'm the founder and CEO of Sound Scouts. There's a few things on the screen there. To note that Sound Scouts has been around for quite a number of years. And in fact, we started development on Sound Scouts back in 2011 and working in collaboration with the National Acoustic Laboratories and in particular, Professor Harvey Dillon. And subsequently, we've won a number of awards and we've secured a number of grants that have enabled us to develop Sound Scouts to the point that it's reached today. I often say awards are fabulous, but the best prize is being able to change the life of a child by detecting a hearing loss that may have prevented them from achieving their potential. And I very much stand by that quote today. It is really wonderful to be heading a company that's purpose-driven and to be able to do something that really has an impact. And I think we'll hear more about that impact today from our wonderful panelists. So on to our panelists. Today, we're joined by Dr. Dani Tomlin, Dr. Gail Hemsley, and Amanda O'Halloran and Sophie Tobler. And I'll share more information about each of our panelists as we're introduced to them. Now, today we're dividing the webinar at the beginning into 3 sections, and we're going to hear from each of our panelists. Dr. Tomlin is head of the Department of Audiology and Speech Pathology and deputy head of the School of Health Sciences at the University of Melbourne. Dani has over 20 years clinical and education experience, established the University of Melbourne Auditory Processing Disorder Clinic in 2012, which now supports hundreds of children per year. Dr. Tomlin's primary research interest is in the field of auditory processing and listening disorders, leading a team of postdoctoral and graduate research students exploring the diagnosis and management of these conditions. So thank you for joining us today, Dani. Can I ask you in general, why is hearing important to learning?
It's a very good question, which you're right, it does seem very obvious, but I think when we think about hearing and learning, there's 2 aspects to consider, which is first of all, the building blocks that good hearing provides you, both in language development, social awareness, interaction, that will allow you to behave optimally in the classroom and to therefore access what the teachers are providing. So there's the language skills that you bring into the classroom, and then it's what you can do when you're within that classroom in terms of access to what the teachers are saying, in terms of what your classmates and your peers are saying, to have access to all of the information that's flying at you. So that's one part of it. I think particularly with universal newborn hearing screening, there's a tendency to think that hearing is ticked off at birth, but unfortunately it's not, for various reasons, including milder losses that may not be detected and also losses that may evolve over time. So particularly I think we're at risk in the classrooms of not recognising milder hearing losses that might be present. And the danger with mild losses is that they can be hard to see within a classroom setting for a teacher or for a child to identify as having a difficulty. So there's the information that the child might be missing that would come with that hearing loss, but particularly when we're looking at mild hearing losses, it's often small pieces of information that they're missing, maybe just part of a word or the ending of a word or a start of a word, which sounds minor, but it's actually a huge impact, not on the change of content that they're receiving, but also the cognitive loading that it places on that child to try and fill in the gaps, essentially. Was that cat or mat or hat that they just said? It's one little sound that's missing, and then they're spending a whole lot of energy trying to fill in that. Now, that is, again, relying on having a good language base to even help you fill in those gaps in the first place. So I think hearing is important to learning for two aspects, not just access to information, but also being able to bring your whole self into that learning experience and not be wasting valuable energy on trying to fill in the gaps.
Your area of expertise is auditory processing disorder. Wondering if you can share some information about that with the audience. I think most people here will know about conductive hearing loss and sensory neural hearing loss. And at Sound Scouts, we're always talking about that third, listening difficulties and noise. If you can tie, the three together, that'd be great.
So maybe one step back to understand auditory processing disorder is to first of all recognise what auditory processing itself is, because the disorder kind of makes sense as soon as you know what it is. So auditory processing is a definition that's often used is what we do with what we hear. And we have moved away from the concept of auditory processing and more into this listening difficulty phase, because it's really a concept of how we listen. Not how we hear, but what we do with what we hear when those sounds are received. How do we make them into something meaningful? And the time when we most notice that we are using those skills are when we are in a challenging listening environment, in particular a noisy environment. So all of us are using auditory processing right now, so that I'm not just throwing a whole range of sounds at you, but it's actually words, and you're putting them in together, hopefully, into some sort of meaning that will allow you to draw the context from what I am trying to say. So in terms of a disorder, it's when we're not very good at doing that. And it's particularly obvious within young children. Any young child is not very good at auditory processing. It's a developmental skill. The very, very early concept of auditory processing or listening is something like localizing, which develops very early. But the much higher level version of that is using those interaural timing and intensity cues to help you focus in on a stream of speech within a noisy environment. So it's a skill. There's various skills involved that we use for auditory processing or listening, and we're still untangling what all of those are. But it is something that as we go, particularly through that primary school age, are getting stronger and stronger at. So what we're actually looking for when talking about children with listening difficulties are children who are not really where we expect them to be relative to their peers. By around sort of 12, 13, so towards the end of primary school, we're expecting it to be fairly adult-like in behaviour. What we spend a lot of time talking about with auditory processing disorders and listening difficulties is the role that language and cognition plays in that as well. So it's really bringing everything together into play to allow us to listen effectively. So as a disorder, it's when we're not very good at it. Does that
yes.
carry the meaning of, yeah, good.
Thank you. That was, very thorough. I know from a study that Melbourne University conducted, and I know you're familiar with it, that around 2.5% of the children tested were found to have an auditory processing disorder. I think I'm going off the questions here, off piece, but I think it also adds value to understand that, this is not a one-off, that there is this significant percentage of children who have this disorder.
And in fact, some figures quote even higher than that as well. So it really does depend on the cohort of children, the age of the children, the cohort of the children, what specific aspect of auditory processing or listening that you are tapping into within that screen. But 2.5% would be one of the lower numbers that we see. But it probably is a good reflection of that really strong speech and noise skill that we need to help us through, particularly with learning and development within the classroom space. So it is far more prevalent than we think. It is often confused with other, well, maybe confused or needs to be separated from other conditions that we might be seeing in the classroom as well. The one we're always backwards and forwards around is children who seem to be having trouble listening, which could be also based on attention and attention disorders, behavioural disorders. That's what we need to pull apart to understand what is causing the individual child in front of you to be having listening difficulties. But we're certainly seeing big numbers coming through the clinical spaces and strong links with learning difficulties as well.
And what are you currently using? I guess if you can combine indicators, which in some ways you've already covered off in terms of those attention issues, but feel free to clarify. And how do you diagnose then APD?
I think that one of the biggest flags should be a child who appears to not be hearing very well should be the first one, even though we have established hearing is normal maybe, because the behaviours can be very similar. Mishearing, misunderstanding, not engaging with spoken content. However, and that can also appear as an attention difficulty. The other flag, learning difficulty, particularly literacy. We're seeing very strong links with literacy development as well. Any flag about why a child is not performing to their full potential within the classroom as expected, I think should be an indicator to consider whether a listening difficulty might be present.
So, and in terms of diagnosis and what happens after diagnosis?
So it depends how we first go about it. If we were to be using a screening program, that would be a very easy, quick way to do it, such as the Sound Scouts. The speech and noise component of Sound Scouts would be a good flag. Full clinical assessment would be the next step, which many audiology centres were offered these days. And that would look at various parts of listening, test various aspects, ideally do a bit of a screen around some attention-based, memory-based behaviours as well, or skills, to see if they are coming up as a particular area of concern. And of course, language as well, to look where the language is sitting next to the listening difficulties. So that would be the next step, to try and really drill down into what for this particular child is the reason for them having difficulty following speech in a noisy environment, because there may be multiple or various reasons for any child why that is the case. Once that is done, then we can start to work on a plan of what to do next.
A recent article that you were involved in had this great caption titled "Listening: A Gateway to Learning." It's so relevant on this day, and I just wondered if you could perhaps just give us some thoughts on how teachers can support children with listening difficulties in a classroom environment.
So this study, we really wanted to see the effect of what we would call a difficult listening environment on children's learning. So we focused on comparing open plan and closed plan, for want of a better word, classrooms. And we found that for a group of children, particularly, well, the children who we identified as having speech and noise difficulties, and children who we identified as having attention difficulties, that their learning slowed down when they were in an open plan environment compared to when they were in a easier listening environment, so that closed plan classroom. The attention piece was interesting as well, because it really spoke to the cognitive load that a difficult environment places on the kids. So in terms of what teachers can be doing to support, I guess it's identifying who in that classroom may be at risk of presenting with a listening difficulty, and promoting for that assessment to be done. Because there are measures we can put in place, whether it's suggesting a different listening environment for that child. There's also supportive listening approaches we can take, such as remote microphone technology, training programs for the children, advice for the classroom environment, such as even sound field systems, to overcome the difficulty that's experienced and to really optimise the learning that can happen.
That's provided us with a great insight into auditory processing disorder, and also the opportunities for support in the classroom environment. So I think that's great. We'd love to have your input in the Q&A section. So we'll move on now to Gail Hemsley. Gail Hemsley is a Senior Advisor, Speech Language Pathology with the Department of Education, Queensland. She oversees the Early Years Connect initiative, a First Nations strategy and partnerships collaboration with deaf and hard of hearing services. Early Years Connect supports improved hearing, language and literacy outcomes using culturally responsive, strengths-based and evidence-informed ways of working. In the hearing space, Early Years Connect has partnered with schools with high First Nations enrolment to support universal screening of all students in their first year at school, ensuring early identification and support for students with hearing loss. So it's my pleasure to actually hand over to Gail, who's going to give a presentation. Thank you, Gail, and welcome.
Thanks, Carolyn. And you'll be happy to know, Carolyn, because I know that you know how much I talk, that I have got some notes to keep me on track today. Okay, so because I just love this topic and I could talk about it all day. So if you go to the next slide, Carolyn, and we talk about why hearing, and happy World Hearing Day, everyone. Look, there are some very convincing stats around why hearing should be front and centre for us here in Queensland. Kelvin Kong, who is NAIDOC's Person of the Year in 2023, describes Australia as having the worst ear disease rates in the world. And the World Health Organization backs that up. They say that if 4% or more of a population suffer from ear disease, it's a massive health problem. That's their technical words for describing that. And we know that here in Australia, some of our remote communities have 70% or even more students affected by middle ear disease. So for us here in Queensland, with over 10% of our student population being from First Nations backgrounds, this is really front of mind. Over 26, just to put it in context for you if you're not from Queensland, over 26% of Australia's First Nations students are enrolled here in Queensland state schools. That is well over 63,000 students. I don't just want to talk about remote communities and rural areas today. We've done a lot of work in urban centres and right here in the southeast corner of Queensland, where we've worked in some vulnerable communities with higher populations of First Nations students. We consistently find somewhere between 15 and 30% of prep students, that's our first year of school, so foundation students, identify with hearing loss that's previously been untested and undiagnosed. So while the numbers are really high and that is a really significant problem that needs to be addressed in our remote communities, it's not just an issue for our remote communities. People sometimes say to me, Gail, hearing is a medical issue. Why are you investing so much of it about this in schools? And I guess sitting in an education setting, we're really interested in our students being able to hear so they can listen and learn in the classroom. As educators, we've done a lot of work around, and particularly the Department of Education, around knowing that in the early years, good hearing is essential for learning, and it's actually the second highest predictor of oral language and literacy learning in the classroom. The literature tells us that even if a child has a mild hearing loss and or a unilateral hearing loss, the kind of hearing loss that people will say, oh, it's only a little hearing loss, or it's only in 1 year, so we don't really have to worry about it. We actually know now that the evidence tells us that the impact of that hearing loss, the magnitude of fatigue that a child with a mild or unilateral hearing loss experiences, and the impact of that mild or unilateral hearing loss on comprehension in the classroom is similar to that experienced by children with bilateral hearing loss and more significant hearing loss. And that is the best et al. Study that's there at the bottom of the page. Fatigue and problems hearing in background noise are just, that is core business for us here in schools. We want our little people to be talking. We want them to be interacting with each other. We love small group work and all that offers, but it does really add to the listening load for little people who have a hearing loss. We also know that if a child has had repeated middle ear disease or long-term hearing loss as a result of middle ear disease, we know that those students will have are much more likely to have long-term speech, language and learning difficulties. And we see those students, even after the hearing loss has resolved in year 2, 3, 4, that the learning challenges for those students really continues because of the long-term hearing loss that they've experienced and the lost learning time that goes with that. There's also a really nice study, and it's just the last dot point on the last slide, sorry, Carolyn, that was done, that's been published this year by Carolyn Mee and colleagues they're over from Western Australia, and they looked at behaviour and attention, and they found that students, where's my notes here so I can say it precisely, they looked at students who were 10 years of age who had a history of middle ear disease and fluctuating hearing loss, and they found that those students were much more likely to exhibit attention and behaviour challenges than students who didn't have that history of middle ear disease and hearing loss. And it's a really powerful study that just highlights for us that often we do not see the hearing loss because it's invisible, but we see the other things that come as a result of that. These kinds of studies are such a wake-up call for us here in education. They remind us that hearing loss isn't just a medical challenge, that it's also a learning challenge. And if we sort out hearing and we send our little people along to see our lovely audiologists and our partners, our ENT specialists, that's a wonderful thing, and that's a wonderful gift that we can give to our children, but it actually doesn't always address the significant impact of hearing loss on learning, or of lost learning time on learning. That is our core business here in education, and something we really need to be doing better at. So over the last 4 to 5 years, so next slide, we've been really working in this area and talking about a whole school approach to hearing. And by whole school approach, I'm talking about multi-tiered systems of support, making sure that all students have access to a hearing test, especially in that first year of school, and then identifying students at risk and making sure those students are able to access both hearing support through our hearing health partners, but also learning support to ensure these students can access learning and experience success in the curriculum. So just 4 quick things that we've noticed work really well in schools is making sure that hearing is everybody's business, not giving the problem to the family, not giving the problem to the GP and asking him to manage it all, but everyone working together, communicating together, walking together to really support the child's hearing and learning. Time is really important, and this is something that's often quite scarce in schools, but if we're going to be embedding hearing within a whole school approach, we really need to be setting aside time for screening, for making sure those results are uploaded onto students' files, and making time to really connect with families and walk with them through the process of follow-up and supporting a child's learning. Here in Queensland, we really love this idea of hearing champions who hold the hearing ball and run it up the field, big footy people up here. It's that idea of having one person for school, and they don't have to be a specialist in the hearing area, just someone who is looking after logistics, making sure that every child in that foundation year gets screened, making sure that every child who is identified at risk gets followed up, knocking on doors and making sure that teachers understand what is happening in their classroom and how they can support learning, and making sure the right supports are brought on board as well. We have speech pathologists and advisory visiting teachers for deaf and hard of hearing in our schools, and they are just really well set up to support these kids if they are identified with hearing loss. And also, because schools are busy places, we know that having some easy to use processes and ways of work really well to help embed hearing screening in schools. I'm happy to chat about that at another time. So one of the processes that we have embedded is Sound Scouts within Queensland state schools. So last year, the Department of Education purchased a site licence for Sound Scouts. This screening is not for particular cultural groups, it's not for particular age children, it's for any student in any state school that needs a hearing screener. And we don't put limits on the number of students that can be tested at in any school. So we found that works really well. So in 2023, the use is really increasing year on year, but over the last 12 months, over 8,000 students were tested across Queensland state schools. And I feel like the test is being used in 3 main ways. So firstly, it's a great tool for prep screening, but screening in that foundation year of school. Every time we do screening in vulnerable schools, we find children with a hearing loss that had never before been tested or diagnosed with a hearing loss. And it's so lovely to walk with schools who say, we didn't realise, we just had no idea, what do we do next? So that has been really powerful to have that as an option for schools. Some schools also use Sound Scouts as a way to rule out hearing loss as a contributing factor for students who have learning challenges, behaviour challenges, attentional challenges. So they're making sure that this is done for any child who, prior to them going, for to the support team or the inclusion team to look at how we can better support this each child's learning. Many schools are also screening students for, on referral to speech language pathologists and guidance officers. Again, they're embedded in every school in Queensland. We know that if, as a speech pathologist or a guidance officer, we do a cognitive or a language assessment and the child has a hearing loss, that the results that we get, the standardised assessments, become entirely invalid. So it's really important for us to know whether a child has good hearing before we do those assessments. Of course, if a student has a hearing loss, we still will assess these students. We just use a different lens for choosing assessments and for analysing those results. Finally, I know that lots of our lovely speech language pathologists and inclusion teachers sometimes use sound scouts to monitor hearing. A child who maybe has had grommets put in and has been hearing well, but then there's a bit of a change in what's happening in the classroom. Sound scouts will be used to see whether maybe the grommets have fallen out and the middle ear disease has returned. So it's used in that way as well. Nearly up for time, but just quickly, I'm going to talk about hearing pathways, which is a smaller project within the Department of Education where we've worked very closely alongside around 40 schools to support cohort screening and to work out what works well in schools within a whole school approach. So we've screened over 1,800 students in 2023. So making sure we screen every student in prep, not just the students who return forms, not just the students who are there on hearing day, which is our special day when we screen hearing, not just the students who have behaviour challenges or learning challenges, every student in prep year, so that we can then identify who needs additional support. That funnel approach again, that multi-tiered systems of support, supporting families with targeted intensive hearing interventions, attending appointments, supporting attendance if we need to, but also as a school really working on how we can support the impact of hearing loss on learning. We work really closely with our teachers around how they can differentiate the classroom curriculum delivery to support little people with hearing loss, like the one you see here on this audiogram. I think that students can teach our teachers far more about hearing loss than we ever can. I can talk all day about hearing loss, but when a teacher has 2 or 3 little people in their classroom with a hearing loss and they're suddenly faced with, how do I do literacy? How do I read a story and ensure they can connect with the content? Suddenly those little people are teaching those teachers far more about hearing than I ever will be able to. It's really important then to give teachers that support that they're asking for around, how do I set up my classroom so that this student can hear better, or so that these students can hear better? How can I adjust the curriculum? How can I adjust my oral language work, my literacy work, my reading and spelling work? And of course, for some little people who have had protracted longer periods of hearing loss, how can we put in place tailored supports for those students to help fill some of the gaps in their learning? Just 2 little examples on the final slide. On the left there, you can see just a list of 8 spelling words. In Queensland, we have a reading policy based around the simple view of reading, which is a lovely evidence-based approach to getting success in reading. We use schematic synthetic phonics approach to teaching reading and writing, which normally involves, in that first year of school, teaching 6 sounds at a time and then learning to read words, little 2- and 3-letter words like you see here, that contain those sounds. Very often, the first 6 sounds that are taught are SATPIN, S-A-T-P-I-N. And if you have a look at a speech banana, you'll know that if you have a mild hearing loss, 4 of those sounds are the first sounds to go. So they're quiet sounds. S, so st, p, and n are very often not heard by our students who have even a mild hearing loss, and certainly not heard well in the presence of background noise. So we try to flip teachers' thinking to say, maybe it's not a reading challenge, maybe it's not a spelling challenge for this child, maybe they just can't hear the sounds that we are trying to teach them reading and writing with. How about we try using some sounds that we know these students can hear well and see if they can connect with that learning. And just one last example there on the right, this is a spelling test for a little person, and the teacher was really worried that this child wasn't progressing, was not able to spell words with 3 sounds in them, like chip, chop and chat, and wasn't able to spell words that contained those consonant blends, so NCH in lunch, bunch and munch. So then again, just chatting to that teacher about maybe it's not a spelling challenge, maybe it's a hearing challenge. And certainly when we looked at the speech banana, this little person wasn't able to hear N. So lunch, bunch and bench suddenly didn't make sense to them because they weren't hearing the N in that word. And of course, when you've got even a mild hearing loss, those initial consonants are sometimes the first things to go. So chip, chop and chat become challenging. So really working with that class teacher to put in place some really basic changes to support that student, using our Conan boxes so that they knew how many sounds they needed to listen for, making sure the child heard the word twice when they were learning the words and that they were looking at the teacher's face. And we also put a SAS system in the classroom, a sound amplification system in the classroom, to ensure that child was able to access the best hearing that they could. So just a few examples of how really understanding hearing can really flip teachers' thinking and make a huge difference for kids in the classroom. Thanks, Carolyn.
Thank you, Gail. That's fantastic. The theme of today, or for World Hearing Day this year, was changing mindsets. And I think you've done a great job over the years of changing the mindsets around hearing, screening and hearing, within the educational setting. So thank you for all your work. Really appreciate it. So now moving on to our last panelist today, Amanda O'Halloran is a CSO Inclusion Officer, and Sophie Tobler is Lead Inclusion Support Teacher, St Nicholas Tamworth, from St Nicholas Tamworth. Both are members of the inclusion team with the Diocese of Armidale, New South Wales Catholic Schools Office. The diocese has been conducting universal screening in a number of schools for the past 3 years and have recently embarked on a program of universal screening for all of their kindergarten students. Amanda and Sophie have hands-on experience with organisation and facilitation of universal screening. So the reins to you.
We just wanted to first of all say what a privilege it is to be part of the panel today. We're feeling a little bit out of our depth considering the expertise in the room with Gail and Dani and Carolyn and Lisa from Sound Scouts. But whilst Gail is talking and explaining how it works in Queensland, Sophie and I are here nodding vigorously and saying this is very much what we are going through here in the Diocese of Armidale with our Sound Scouts experience. So if you could just flick through to the next slide, please, Lisa, that would be great. So just a little bit of information about us at a glance. The Armidale Diocese is quite a large diocese, 500,000 square kilometres. So yeah, quite a range of area. Our furthest point is Tenterfield in the north, up near the Queensland border. Then we go all the way out west towards Walgett and Mungindi. Mungindi is also right at that northwest corner near the Queensland border. Right down to a little tiny town called Quirindi in the south, which is at the tip of the northern tip of the Hunter Valley. So we have quite an extensive range really from the Queensland border inland down to the tip of the Hunter Valley. So we have a very large area to cover in our schools. Our major centres are Tamworth and Armidale. Tamworth is a regional city of around 66,000 people. Armidale is significantly smaller, but that is the seat of our church, of our diocese. Therefore, that is where our Catholic Schools Office is located. We have 24 schools, 19 primary, 3 secondary and 2 central. And our smallest school is St Joseph's in Warialda with a grand total of 24 students. Warialda is near Moree. Some of you may be familiar with that geographic location. And our largest school is our secondary school here in Tamworth McCarthy Catholic College with just over 2,100 students. So quite the range of schools and locations and populations in our beautiful Diocese of Armidale. I just wanted to add some visuals to our presentation today, and we talk a lot in our diocese around putting faces on the data. Many of your educators might be familiar with that term if you've done any work with Lynn Sharrett. And so here are some of the beautiful faces from our schools, ranging from O'Connor in Armidale to Moree to Walker to Walgett to Tamworth. And really for us, our mission vision as educators working in our diocesan system is to create a literate and numerate, to give the opportunity for students to become literate and numerate for a hope-filled future, that every student in our system has the ability to reach their full potential and live a hope-filled life moving forward.
So today we're going to talk a little bit about why we choose the wonderful Sound Scouts resource, which as we go on in our presentation, we've had some great success. So we understand the recognised impact of hearing loss on learning, social connection and wellbeing. And I'm based at St Nicholas, which is one of our many schools within the Diocese of Armidale. But I know we've had very successful prior experience with both universal and targeted screening, not only here at St Nicholas, but within the wider diocese as well. When we talk about the universal screening, we screen all of our kindergarten students. It's our aim to screen them within their first year of school. And we also use the targeted testing and screening as well for students in other grades based on areas of need. So Sound Scouts definitely sits within our suite of screening assessments. And as Gail was saying, it's one of the first screening tools that we reach for. We find that it's a very worthwhile way for us to be able to guide families, guide teachers. And we also love that we get instant results, instant feedback. We know straight away what we can rule both in and out. So it's definitely sits within our suite of assessments with other screening assessments that look at language and
So essentially a teacher will come to Sophie as the inclusion teacher or the other inclusion teachers in our schools. They'll have concerns around a child's learning or their academic progress or their social well-being or their emotional regulation, whatever it might be. And Sound Scouts is always one of the first tools in our toolkit that we use to rule in or rule out a potential hearing loss. We always start by, thinking about ears and eyes. So hearing and vision, if we can rule those things in or rule them out, then we know that we've at least started with those core basics that can affect so much our learning and socialisation. When we break down that screening assessment suite, Sound Scouts is there, the Self-5 screening test is there around oral language development. We use the KBIT2, we use dyslexia screeners. We have a whole suite of screeners that we tap into as we need to based on the need of the child, really as almost like a case management project when we have concerns around learning or social development. So why do we really focus and why have we invested as a diocese in Sound Scouts? Well, we absolutely recognise that we have limited access to allied health services, whether that's speech, OT, hearing services, psychology, paediatric services. It is a real issue for us in both of our regional and our remote centres. An example here is in Tamworth. We have 2 staff paediatricians at the Tamworth-based hospital, and they service all of the New England Northwest. So, and often when we finally get families through the door to a paediatrician, usually after a 12 to an 18-month, maybe even a 2-year wait, one of the things that the paed wants to know is, has there been a hearing screener or has there been a hearing assessment? So if we can start that ball rolling before they get to that appointment, then we know that we've, set that family up for success at that point of intervention with the paediatrician. If there's more information around that, we can provide that. We also recognise that there's very limited, or really, to be honest, a non-existent preschool screening in our region. Limited in the fact that we have a handful of preschools that do use Sound Scouts and that are happy then to share that information on with the feeder primary schools during that transition to school statement period, which is fantastic. But the reality is, for the vast majority of our preschools, they are not doing Sound Scouts or a hearing screener. And whilst it would be amazing if New South Wales Health rolled that out as a stock standard screener across every preschool, we acknowledge that that's not the case. So we feel strongly around having a duty of care. We've got the tool, therefore we should do something about it for all the reasons that Gail and Dani have spoken about already today. And we also wanted to purchase a bulk amount of screeners because we want our students, regardless of where they live, how remote and how far away they are, we want everyone to have access regardless of their geographic location. And the beauty of Sound Scouts is that all we need is really an internet connection, and we can provide that even in our furthest centres. So for those reasons, and there are more to come, but there are some of the key reasons so far as to why we as a diocese has invested in Sound Scouts over the next 12 months.
So continuing on with our why, when we look at, administering the Sound Scouts, we love how it's simple, it's effective, it's efficient. Teachers can administer the Sound Scout screener, which is something that we do here specifically at St Nicholas. We have a wonderful teacher who works hard to support us in the screening assessment. And the instant feedback, as I was saying, it allows us to be, it really helps us to inform us of what the next steps are. So we love how simple it is. We also love that it reduces pressure on families. We understand that families are really busy, and we know that to be able to take a child to have a hearing assessment, it often requires our families to come out of work or interrupt learning at school. So it works really well that we can administer it within our diocese, and also within the school environment. We have a captive audience. So we have these kindergarten families, we have, you know, the students, we have them here at school. We're able to have a look at what a typical day looks like here at school, and we're able to work in with the areas that might be, you know, the prime opportunity to administer the Sound Scouts assessment. So we really tap in on the fact that we have that captive audience. And
even though we are aiming to screen all of our kindergarten cohort across all of our schools, we have that ability, as Gail was talking around, you know, triaging the students that we screen first, starting with our First Nations students, and then as students come to us with, you know, particular concerns, or teachers have particular concerns, but over time we will screen up the entire cohort over the 12 months of kindergarten. Just the other beauty of Sound Scouts is, from my perspective, working at head office rather than being in a school anymore. I'm only recently out of a school and into head office, but the ability to manage the platform from our level, from the diocesan level. So we've purchased the credits. Our ICT team at the CSO have used our Compass platform, which is our digital management system, to then bulk upload all of our kindergarten students with the correct names, correct dates of birth, all of that important vital information. And we're able to manage that from a diocesan level and to view, as the super organisation, what's happening in each of those organisations that fit under our banner. So having that central ability to monitor, to evaluate, to review and to control, and to provide help to schools who might be having issues with a login or issues with a child being uploaded or whatever it may be, it gives us a great sense of systemness, and that's worked really, really effectively this year.
I know as a school, we definitely appreciate having that support at a system level.
We just have the next slide. Thank you, Lisa. So we just wanted to put in a few numbers, and it was great to see Gail's numbers, and we thought, well, for a small diocese, we're not doing too badly. So since 2019, with universal screening in only a handful of schools, but including 2 of our largest primary schools, we've done over 1,300 tests, 196 fails and 149 borderline results. And Soph and I, as we were preparing today, we were saying, obviously that doesn't mean that we've got 196 or 149 students in our school that now have a hearing loss, but that has been 196 and 149 points of conversation with teachers and parents around what do we do next. So, and that really has been invaluable. And we, even just at St Nick's, picking up the stories, the anecdotal stories around little people that have been screened, and then there's been further medical intervention, and, you know, grommets have been put in place, or they've been to see the audiologist at Hearing Australia, whatever it may be. That for us gives us the motivation to keep going, because we know that that has made a really significant difference in the learning of that little person. And if we can do that for more and more little people, then we can rest easy. Yeah.
I know our families speak very highly of Sound Scouts, and they've definitely been able to see firsthand the benefits.
Yeah. So with our universal screening this year, we will hope to see quite a significant uptick in the amount of screeners that are administered. And we would hope to see some increased referral rates, resulting in more diagnosis for our students if that's what's required. And then the appropriate medical and school-based adjustments can be put in place to support the learning of our most precious students.
Thank you. That's wonderful. We really appreciate you sharing your experiences with us. We've, heard and acknowledged that we don't have enough clinicians And, you know, we also have situations where children may not be at school. The children most in need may not be at school on those 1 or 2 days where a hearing specialist is sent out to do screening. So I think, you know, what I'm really conscious of is the use of technology to deliver a solution that is then accessible to everyone and can identify children and really change, from my perspective, the mindset around screening and identification, and then passing and, you know, and supporting those children to see clinicians for diagnosis and treatment. I guess maybe that's a comment, but I'd welcome your input.
To me, it's really about that remote access piece. Is you can't get past it. So much need for screening programs, particularly rurally, and they're not out there. They don't exist. With a different hat on from a university perspective, we get requests all the time for student-led screening programs. Can you come? Can you come? Can you come? We can't go everywhere, and hence why we've been doing some work looking at the feasibility of replacing screening programs, much as is already being done elsewhere, clearly. So it's a great answer for that remote healthcare crisis that we're facing, remote rural communities requiring support. I think it's where we're going with tech, and it's what we've got to do. So yes, I think it's exactly what's needed.
Even in our regional and urban areas where, again, there is a huge demand for screening, I think something like Sound Scouts can really take the pressure off the health system. And I know, rather than us sending a lot of students to the limited available services and saying, can you screen these 300 students, if we can do the first pass using something like Sound Scouts and identify students who are at high risk of having a hearing loss and just send those students along, it means that we are taking the pressure off our really limited services and only sending the students who we're most concerned about. So I feel like that has made a difference within the Queensland sector for us. There's some grateful health people who are pleased that they don't have to screen all of the students, just the ones that are identified.
Lisa has been managing the questions.
The first one is for Dani. Are you able to share some of the training programs that can be used to support students with listening difficulties?
Only in that there isn't a one-shop-fits-all type of solution. So the correct approach is to really drill down within that child to see what their listening difficulties are being caused by, if we can, and then picking the right training program to address that. So it's certainly not and what one will do, because we have had those discussions with parents. Can I just skip the assessment piece and go straight to the training program? And I would strongly disagree with that approach, because not everything will be the right solution for that child. So, but in terms of design, most of these are computer-based training programs. So they're really trying to gamify and bring up, engage the child in this, because it is sort of often a couple, maybe 12 weeks worth of training potentially, and really upskilling slowly as we go. So the need to make sure we've got something that works, that doesn't drag them out of school 4 times a week for 12 weeks. That's not going to work either. So again, we've fallen back on the tech for a lot of these solutions. So there's various platforms out there that are offering training, but I would be very keen for families to make sure that it's the right one linked to the remediation that they actually need.
It is really challenging in regional and remote communities to ensure that there are follow-up pathways. And certainly we've been working with existing, I think part of what we've really been trying to do here in Queensland is, when we go into an area and they ask to work with us, is looking at what services already exist and where there may be gaps, and how we can then work with services to fill those gaps. And so it sounds like that is exactly what needs to happen out in Western Queensland. But certainly really interesting to Amanda, and I just loved your presentation. It was just so interesting to hear how you are engaging with hearing, even though you don't have good access to services there as well. And I think that's the idea, isn't it? That we know which students are at risk, and while we're waiting for those magical things to happen on the health front, still doing something at the education front. And I think that's kind of our attitude as well. We know sometimes there can be quite a long wait for ENT services to have grommets put in, whatever needs to happen. But let's get on with that, with our core business of getting students learning in the meantime and doing the best we can for them in the classroom.
Thanks, Gail. Amanda, it would be good from a New South Wales perspective. Did you want to add anything there in terms of services?
I think our diocese is very much reflective of the rest of New South Wales in terms of access to, you know, OT, speech, audiology, like any kind of allied health service seems to be a real point of contention across the board. And you know, even for us, you know, I guess we're lucky in a place like Tamworth where we do have a community health service. We do have Hearing Australia located here in our main street. But for our other service, for our other areas, knowing that families may have to travel, knowing that they may end up going to Newcastle or Sydney to access services if it cannot happen in their immediate area or if the waitlist here is too long. And really for us, it is, you know, knowing full well that yes, it is a screener, it's not a diagnosis, but knowing that for our teachers straight away that they can put adjustments in place in that classroom as of tomorrow, whilst we're waiting for those specialised services to happen. So, you know, whether that's something as simple as making sure the child is sitting at the front of the group, whether it's making sure that they check in with the child after instruction is given so that they can double check that they know what they need to do next. Maybe it might be providing the visuals on an individualised whiteboard. This is what you do, step 1, step 2, step 3. So they're not relying on that listening load to understand what has to happen to be a successful learner in the classroom. So yes, the referral pathway is frustrating and it is part of the bigger picture, but for us it is also that immediate feedback to parents as to, you know, this could be a possibility, this could be a reason why your little person is finding it difficult in the classroom situation or even at home sometimes, if the behaviour happens to flow from school to home, and then what we can do tomorrow to support that child in the classroom without a diagnosis, because we've got a good hunch thanks to the Sound Scouts.
Thanks, Amanda. I think that's really valuable. We know at Sound Scouts in many of the conversations we've had with people in outside of metropolitan areas that it might be a 2-hour drive and then a 4-hour return trip for a diagnostic assessment. And parents will be reluctant to do that, not having some information to go on. So when the child's failed Sound Scouts twice and the indications are there, there's a lot more motivation to make the trip. Often when you're in a metropolitan area, you forget about the realities of, you know, being on the land and having to take time off.
The cost of the transport, the cost of accommodation, as well as the need to leave, you know, a farm or whatever it might be for several days to get to Sydney. And for some of our areas, you know, they may need to wait for weeks, if not months, for a fly-in, fly-out allied health service, potentially. So all of that plays into factor for us in terms of we want equity of access for everybody in our system. And, you know, we feel as though Sound Scouts is a great tool for that in that universal screening capacity, but also in that targeted screening for our students that come to us at any grade, you know, year 5, year 7, year 3, year 9. If there's an issue, then it's something that we can do. We can rule it in, we can rule it out. We can guide families in that direction as to not waste their time and to use their time wisely and effectively.
Yeah, what do you think will be the mindset that you can change that will have the greatest impact? Gail, can I ask you to go first, perhaps?
I think my advice would be, and I think that the Armidale Tamworth group have done a similar thing. They've started small and then they've built from there. And what we have found is that when we do well in a small number of schools, so if we go into an area like Rockhampton or Hervey Bay for the first time, we always go into a small number of schools where principals invite us in, where we don't say, can we come in? We say, we've got this, who wants it? And we have a small number of schools that come on board. We work with the willing, we get really lovely results, and that creates a ripple effect of excitement. And then schools will, we see the service really grow. And I think that's kind of been the experience in all of the areas that we've gone into. As soon as we start to get those success stories coming through, and we all know that principals chat to each other and guidance officers chat to each other, that then we start to get the requests that come in. So we actually have more schools asking to be part of Hearing Pathways at the moment than we can actually service, that we can support. So that's a lovely problem to have, and something that we are really excited about. But I think it is about having those, making sure that you do what is manageable, and making sure that you do things well, starting small.
Thank you. Fabulous. Dani, would you like to offer your thoughts?
So many. Let me focus on what I was here to talk about today, which was listening difficulties. I guess the takeaway message for me is that children who have listening difficulties are children who struggle in the classroom. That's without doubt. But there's plenty we can do about it if we know about it. So it is so important to identify who these children are. It's also important to take it off the table for children that it's not the reason why they are struggling to attend or to engage or to learn. So let's find out, I guess, is my impact statement, because there's so much we can do. And given the healthcare crisis that we're in, particularly in the allied health space, a tool like this that allows us to quickly start to answer this question for any individual child is a very powerful tool.
Thanks, Dani. Thank you. And the last word to...
Look, I think I really like what Gail said in terms of starting small, but I think a big part of it as well is educating not only teachers, but the wider school community and families about, what we have on offer, and making sure that people have a really clear understanding that our intention is to help, and at the end of the day, we want what's best for the child. We've got their best interest at heart. So, yeah.
Thank you. Thank you all for joining us today. Really appreciate your time, and thanks to the audience also for joining us. Happy Hearing Awareness Week.